Okay, welcome everybody to today's meeting of the Adults and Communities Overview and Scrutiny Committee meeting on Monday the 7th of June at 2 o'clock. Can you all hear me okay? If you can on the people on Teams. We're just moving to the appointment of the chairman item to confirm that Mr Richardson was nominated as chairman-elect at the County Council meeting on the 19th of May. Could I please ask that the committee confirm this is agreed by formal nomination, and somebody to second?
I'd like to nominate Terry Richardson.
Thank you. And
happy to second.
Okay, thank you. Over to you, Chair.
Thank you, Lauren, and thank you, members. Welcome to today's meeting of the Adults and Communities Overview and Scrutiny Committee. As usual, this meeting is being broadcast live via the County Council's website, and it will also be available for viewing after the meeting. It's the first time this committee has met in person for more than a year. Due to the continued restrictions, we are limited to the number of people we can have in the room, but welcome to all those that are here. And therefore, some officers will join us online and are presenting reports virtually. Can I please ask that all members and officers have their microphone on mute until they wish or are invited to speak? As we have a number of newly elected members joining the committee, I'm going to ask members to introduce themselves. I have received apologies from Mr Mia, with Mrs Newton acting as his substitute, and apologies from Mrs Broadley, who has Mr Mullaney acting as her substitute. So if I can go round in order and just ask people to introduce themselves. So if you just say your name and which division you represent, that would be great, starting with Mr Champion.
Thank you, Chair. Barry Champion, member for Market Harborough East.
Mr Chapman.
So I'm Nick Chapman. I represent Glenfields, Forest and Muxlow division.
Mr Hills.
My name is Ross Hills and I represent the Mallory division.
Mr Mullaney.
Michael Mullaney from Hinkley de Montfort division.
Mrs Newton. No, it's just to introduce yourself, Betty. Just to introduce yourself. If you can say your name and division. If you can switch your mic on, Betty.
Newton from Loughborough. I'm Loughborough North Division, subbing for Jewel Mayor. Thank you.
Thank you, Betty. And we have an absence of Mrs Amanda Wright, if we can just note that at the moment. And before I go on, if I can welcome any members of the public that are actually dialing in online, and if I could also welcome Mukesh, who's on from Health Watch, who is one of our regular attendees and has a permanent invite to this. And we also have the portfolio holder here and the and her support member. So it would probably be appropriate if you could introduce yourself, Christine, followed by Ted.
Yeah, I'm Christine Radford. I'm the Cabinet Lead for Adults and Communities and I represent Shepshed.
Ted.
Good afternoon, everybody. It's Ted Parton from Loughborough South Division, and I'm the Cabinet Support Member in the Adults and Communities Department to Mrs Radford.
Thank you, Ted. And Mukesh, would you like to introduce yourself as our permanent fixture on the committee, we're pleased to say?
Thank you very much, Chair. My name is Mukesh Barot. I'm the Chief Officer for Health Watch Leicester and Health Watch Leicestershire.
Thank you, Mukesh. We'll now move on to agenda item 2, which is the election of Vice Chairman. And I have great pleasure in nominating Mr Nick Chapman. Do I have a seconder?
Happy to second, Chair. Barry Chance.
All those in favour? Right, thank you all. Welcome, Nick, and congratulations. We're now moving on to agenda item 3, which are the minutes of the meeting held on the 8th of March 2021. I propose that the minutes of the meeting held on the 8th of March are taken as read, confirmed and signed. I think there's probably only a few of us here that were here for the meeting, so I'm happy to note they're a true record. Everybody happy to take them? Thank you all. Agenda item 4 is question time. No questions have been received from members of the public. Agenda item 5 is questions asked by members under Standing Order 7.3 and 7.5. and no members have been received from, no questions been received from members. Agenda, sorry, I've just let her. Thank you, Amanda. We'll just take a slight pause. The final member of the committee has been delayed getting here and she's just taking her place. Right, if you're ready, Amanda, we're just on to agenda item 6. But before we do that, we asked everybody to introduce themselves at the start because we got a lot of new members on the committee. So could I just ask you to switch on your mic and give your name and which division you represent? Thank you.
Yes, I'm Amanda Wright, Burbage Division.
Thank you, Amanda. We're now on agenda item 6, which is to advise of any items which the chairman has decided to take as urgent. We have not been notified and there are no urgent items. Agenda item 7 is declarations of interest in respect of items on the agenda. Do any member wish to make any declaration of interest that they haven't already done so? We always record as given those members that are also district council members. It's a standard note which is put in the minutes. Do any other members have anything they wish to declare? Right, that's brilliant. Thank you. Agenda item 8, declarations of the party whip. We have no declarations from the members from the party whips. And presentations, agenda item 9, presentation of petitions under Standing Order 35. No petitions have been received. With all the following items which are now coming up, the substantive ones, can I please ask members to allow officers to present their report and then to indicate that you have a question, please unmute your microphone and I will call upon you one at a time. To be sure that everyone has their say, I will finalise by calling on all members to ask if you have anything further to add. So without ado, we go to the first item on the agenda, which is agenda item 10, which is provision of short breaks and supported living services, which is pages 13 to 20 of the agenda pack. And I will ask the Director of Adults Community, John Wilson, to start off, and I think he's going to bring other members, other officers in to add further colour to this report. John.
Thank you. In June 2018, Cabinet agreed recommendations for long-stay residential services at the Trees in Hinckley to continue to be provided, subject to a reconfiguration and refurbishment of the existing building. It was also agreed that a new short break service be developed on the Cropston Drive site in Colville to replace the existing Smith Crescent short break service. 2019 Cabinet approved funding from the capital programme, including £3.7 million for the redevelopment of the Smith Crescent Cropston Drive site, and plans were subsequently approved by Cabinet in June 2019. On the 8th of March 2021, Committee received a report which outlined change proposals for the future use of the Trees residential care home and the development of the site at Cropston Drive in Colville. Committee confirmed its support to the planned consultation and engagement with those who use the services. On the 23rd of March, Cabinet subsequently agreed to commence a full consultation exercise on the following proposals: to close Smith Crescent short breaks service in Colville, to expand the existing facilities at the Trees, the provision of short breaks, bringing a total of 12 beds in Hinckley, and to withdraw the current proposals for the redevelopment of the Cropston Drive site, subject to consultation. Cabinet did note at the time a slight change to the consultation that was previously brought to this committee, in that we then proposed to have a formal engagement with the 17 people and their families who use the services in Smith Crescent ahead of the full consultation. Further report will then be provided to Cabinet on the 20th of July of this year, with the outcome of the consultation. So committee is asked today to provide comments on the progress so far in terms of the engagement with those families that use the services and the full consultation which is currently in progress. As there's no committee meeting prior to the July Cabinet date, a full report on the consultation will be provided to all committee members ahead of Cabinet so that full comments can be made. I'll just hand over now for the detail to Heather Pick and Claire Jones.
Thank you, John. So as John's outlined, we have commenced our consultation, but there was some pre-consultation engagement that took place, and you'll see that we did manage to have conversations with 16 of the 17 individuals and families that are part of the current service at Smith's Crescent. The 17th person has already commenced short breaks at Hinckley and is happy with that. So 15 discussions were held. We also were able to have staff engagement and the consultation, which commenced on the 10th of May, will close on the 20th of June. So far, we've had responses and we continue to receive responses. A breakdown of those responses are 46% from interested members of the public, 17% from family members or a carer of someone who uses short breaks, 17% have designated themselves as other, 9% are from members of staff of a social care organisation, 6% from short break service users themselves, and 6% from other care professionals. As John reported, we will be consolidating the full responses for a report to Cabinet for the 20th of July when the consultation closes. Anything you wish to add, Claire?
Thank you, Heather. It was just to say that obviously the engagement that we've had with families, not only through the telephone calls and through the face-to-face meetings, but we've also continued that in terms of some meetings at alternative services just to showcase our other facilities that are available.
Thank you.
Thank you, Heather and Claire. Do members wish to speak? Betty. Betty, could you put your mic on, please?
Had it switched on. I think this is hitting it. That's the problem. There's consultation going on, and I just wonder that there's a certain amount of staff that are temporary redeployed. What happens when you have decided what the system is going to be? When we've come out of COVID, will there be an increased demand for services or what? But I just wondered if there's been consideration to be given to sort of the medium and long term approach to this. Thank you.
So we have throughout this been mindful that people haven't been accessing short breaks, etc. And we have been fortunate in the council that we have been able to offer redeployment amongst other services that are open to our staff, and we've been very grateful for their cooperation and for their input into that. But it has meant that we have been able to offer where people can work for them, and we will continue to do that. We do have a number of vacancies throughout our in-house services, and as you know, we have increased demand in certain areas which are looking at assisting with hospital discharge, home care, and our short breaks and community life choices. So we will continue to make sure that we can utilise the staff where appropriate to work.
Thank you so much for that, Chair.
Mike.
Thank you, Chairman. Obviously, the Trees is a facility in Hinckley, and I think it's important that we followed the wishes of the former residents of the Trees, and as they've expressed a unanimous view that they would rather remain at their current locations rather than go back to the Trees, then I think it is. This sounds like a good idea to use this facility. It's obviously been refurbished. It can do a good service in terms of short breaks. And I've noticed from the consultation that the bulk of the people who've responded so far also think that it's good to use the Trees as a short break facility. Of those who've expressed a view on the issue, the bulk have agreed with it. So yes, it seems a reasonable way forward for the Trees.
Thank you, Mike. I don't think it's a question really there. Do any other members wish to speak? I'll just make the point that under paragraph 30 on page 19, I did speak to the portfolio holder, Christine Radford earlier this afternoon. Because I appreciate what you say, Mike, about it's in your division, but this service is a county-wide service that just happens to be provided in certain locations. And therefore, I think we need to look at the views of all residents as expressed by councillors on their behalf. So Christine has no objection, and I think it would seem sensible if members agree that we should have every county councillor should be copied into the report, because they may be able to put some input in from their own divisions from residents who use the facilities. And I think that just makes sure that, I think as you alluded to, Mike, that we get the best possible consultation responses from the widest possible area. So I think a member's happy that that's done. So, right, that's brilliant. So we'll do that. So I think as you've seen, John, largely the committee are supportive on this. We look forward to the final paper with interest. But I think, I think we all agree that the desire of this council to get this right and provide the right facilities, irrespective of their location, is the key point. And I think the committee are supportive of that. So thank you for that one, and thank you to Heather and Claire for their comments as well. We're now moving on to agenda item 11, which is the Unison's ethical care and residential care charters, set out on pages 21 to 28 of the agenda pack. And it's, in fact, I will keep saying this all afternoon. Back to John.
Thank you, Chair. Members may recall in December 2020, in response to a motion raised, the County Council noted that officers would look at the implications of signing up to the Unison's ethical care charter, both for home care and for residential care. Now, that work would include engagement with providers and wider stakeholders to identify if elements of the charters could be included in future publicly available delivery processes and contract conditions. County Council noted that should a cost be involved in signing up to the charters, and should that cost exceed the Council's ability to fund the commitment, then the County Council would pledge to campaign actively with the government to provide for increased funding required. The adoption of the principles of the Charter would demonstrate a commitment to sustaining fair pay and conditions for the care workforce across Leicestershire, which research has evidenced would have a positive impact on the quality of care provided. In March of this year, a report was presented to this committee on care home sustainability, which included some details of the initial work undertaken to consider the implications of signing up to the charters. Today's report provides the committee with a fuller consideration of the implications of adopting the standards within the charters and advises members on the council's intention in these matters. So I'll now hand over to Nigel Thomas and Kate Ravel, who will take members through the detail of the report.
Thank you, John, and good afternoon, everybody. So the object behind the care charters is really to establish a minimum baseline for the safety, quality and dignity of care provided to service users by developing more equitable terms and conditions offered to care workers in both home care and residential settings. And in your paper on paragraph 7, that is outlined in 2 corresponding charters, one for home care and another for residential care. And the adoption of the principles set out in the charters would demonstrate a commitment to sustaining fair pay and conditions for the care workforce, which research has evidenced can have a positive correlation with the quality of care provided. It provides the council with an opportunity to promote better recruitment and retention within the adult social care workforce. We know from data supplied by Skills for Care shows that for home care providers with Leicestershire's Care Quality Commission CQC registered non-residential care services, there's a 53% turnover rate compared to 31% nationally, and 40% of leavers exit the sector altogether. Non-residential care services also have a very high proportion of 0 hours contracts at 60%. And this provides some evidence that capacity challenges which can occur within the home care sector might be affected by terms and conditions of the workforce. And that same source shows that for CQC registered care homes, the turnover is lower at 27.8%, with 28% of leavers exiting the sector and only 8% on 0 hours contracts, compared to a national average of 9%. So consideration of the impact that the charters, if adopted, would have on the council's own workforce beyond the care arena would also need to be undertaken to really get an idea of the full implications for the council. And this really isn't a straightforward exercise because the structure of benefits packages does vary considerably between those already provided by the council and those proposed in the charters. So, for example, the local government pension scheme, leave arrangements, sick arrangements, there is a variety of arrangements across the various sectors. And it's also worth noting that the care charters and real living wage are set by organisations that the county council has no influence over. And they don't have to take into account the wider implications on the county council, such as affordability. And this would be a key consideration in any future adoption. So paragraph 17 to 30 of your report focuses on the home care charter. And this is phased to allow for a staged implementation on the charter itself. The council currently meets stage 1 requirements, covering areas such as commissioning visits based on client need and allocating appropriate times per visits. But the later phases will inquire further engagement with providers and an understanding of the impact on the council and its finances. And as the committee will be aware, the council with East Leicestershire and Rutland Clinical Commissioning Group and the West Leicestershire CCG is currently tendering for the Home Care for Leicestershire service, which is scheduled to be implemented from the 1st of November of this year. This specification for this tender does identify that the market for home care services remains challenging in terms of recruitment and retaining the workforce. And we remain committed to working collaboratively with providers. So part of the work within that tender is really about working with those providers to look at how we can progress in terms of moving towards the charter, because research has evidenced that this can have a positive correlation with the quality of care provided. So to make progress towards improving the market, providers as part of that tender are being required to commit to working with us to improve employment practices over the course of that framework period as part of a staged implementation. And this will allow the implications of the changes on providers to be understood, particularly for those businesses that deliver a significant amount of care outside of the framework. And the indicative approach to exploring the employment practices recommended through the charter are given from paragraphs 26 through to 27, and these set out what the various stages are. So for year 1, stage 1, detailed in paragraph 26, we'd anticipate that a lot of the providers already meet those standards. But when you look at paragraph 27, which would that engagement and conversation would take place in years 2 and 3 of the framework agreement, that contains clauses within the charter which probably going to be more difficult to iron out with providers, and we'll need to understand how we can work together to progress towards that. Paragraph 28 looks at within that framework the performance indicators that are set out for those Home Care for Leicestershire contracts, and they cover things like people in receipt of care will be allocated the same homework worker wherever possible, and you can appreciate, I'm sure, that that's not necessarily an easy thing to commit to, and workers are paid for travel time and travel costs. Things like that are in that further discussion. And it should be noted that this charter might have a wider applicability to supported living and extra care, and this would need to be considered as part of the Council's research into the appropriateness of adoption. Moving on in the report, paragraphs 31 to 35 focuses on the residential care charter. Very similarly, it's aiming to do essentially the same things. Its themes are detailed in paragraph 32, protecting and supporting residents, training and support for employees, and decent pay for quality work and time to work. And as such, that charter's got many of the same commitments as in the home care charter. Residential care for adults is the council's biggest budget, and as such, a thorough assessment will need to be made before an adoption can be considered. Paragraphs 36 to 39 look at the proposals in terms of what we're doing with the current procurement of home care. And also notes that there is the potential to create a differential approach to different sectors of the care market, but this can be viewed as being in line with our council's overall strategy and vision for the adult social care service, which is to promote people's independence by supporting people in their own homes wherever possible. And the single biggest limiting factor in providing people with support at home is the capacity and capability of the workforce. And if that can be improved and standards move towards improving those standards, then we will be taking a real role in shaping the market to achieve its strategic ambition. Paragraphs 42 to 47 look at the finances, the financial implication. For the home care charter, this is expected to have a lower cost than the residential care charter, and the new pricing for home care for Leicestershire has been set at a sufficient level to allow for a number of those elements in the charter to be incorporated. But until it's understood how providers would adapt their business to implement those changes, the overall impact can't be quantified. But if we look at residential care, if we take something like the real living wage, that alone would have an indicative impact on the residential care budget of an increase of around 5%. This would mean a 5 million increase to the residential care budget of 100 million from the first year of adoption. Now, clearly, the MTFS for 21-24 doesn't include funding for the adoption of that care charter with residential care services, but further work will really be required to fully understand that full financial implementation, and it's proposed to consider these issues as part of the planning for the residential fee review, which is just about to begin this summer. So happy to take any questions on that paper.
Thank you, Nigel. The first question is from Betty.
See what I'm doing. It's really about how well can we actually work with independent providers in terms of ensuring or encouraging them to actually implement a real living wage. Many people working in the independent sector don't have the same standards that we would have as a council. And I think too that the morale of many of the workers, care workers, is quite low at the moment because there's increased demand, but there's not increased remuneration or an increased package of care looking after the workers. So what can we do as a council to ensure that those care workers are treated respectfully by the independent sector?
Before I just hand over to John and Kate for any further comments, I'd just say a couple of things. One is that, yes, sort of obviously it is an issue that we'll need to discuss, but what we are saying, particularly with the home care charter, is that we are we are saying to people, have a conversation with us about this issue. And it's probably worth noting that sort of to date, we've had a very full response to the tender, which gives us an indication that people are prepared to have that conversation with us.
John, do you want to add anything? Oh, sorry, Kate.
Thank you. Yes, there's just a couple more comments I'd like to make. As Nigel has said, we have included within the tender specification for home care for Leicestershire that organisations expressing an interest in being a home care for Leicestershire provider should be willing to have have engagement with us around how we might, if the council does decide to progress the charters, to phase and implement it. We recognise that although a number of the earlier elements for adoption in phase 1 are more straightforward, those that move through into phase 2 are slightly more complex, and different organisations will have different considerations depending on their size and nature of the type of service that they provide and how they do it. So what we really want to do is to work with organisations to ensure that the phased implementation of the charters, if the council does implement them, is realistic and achievable for all providers, and in turn reflects doing the right thing for workers. And what we want to do to ensure that providers engage with us on this, if the council does decide to progress the charters, is to put a monitoring system in place to track implementation. Again, we recognise that it will be more straightforward for some providers than others, and we want to learn from other council areas elsewhere in the country who've already implemented the charter or charters to understand what's proportionate and effective, to make sure we get it right for providers and in turn for workers and in turn for people using the services.
To answer your question, Betty, or do you want to come back? Barry?
Thank you, Chair. I noticed so stage 1 is already implemented. I just wondered with stage 2, how are any of those parts implemented with various providers? Are we at sort of a ground zero or on a percentage basis? Where do you think we are on those?
Kate, did you want to pick that up?
Yes, I certainly can. I'm just calling them up in front of me. They're at the stage 1 requirements are at paragraph 26 of the report, and stage 2 at 27. I think it's fair to say that those in 26, which is stage 1, as you've alluded to, are more straightforward to achieve. They're more basic requirements. I think within stage 2, there will be elements which providers will find more straightforward to implement than others. And what we really want to do is to work with providers to understand which are more straightforward and which require further thought and later phasing, 0 hours contracts being an area that needs particular consideration.
And I'd just add to that, just to pick up, we're not starting from a ground zero here. There will be a variety of providers that, sort of will perhaps already have those things in place, but others that won't, and we'll need to understand that throughout the course of the certainly the home care life of contract.
Yeah, if I could just add a further comment and just pick up the last one that Nigel made. We have got, as Nigel said, 142 providers that have responded to our current tender that's out at the moment. And obviously, once we've had an opportunity to evaluate those submissions, we'll have a much better understanding of where providers are in terms of their current implementation. We'll be able to bring a report back to committee in the autumn, which advises committee on that very issue. The other thing I'd say in response to that one and in response to the earlier question, Councillor Newton, the number of the providers that we have, a large number of providers we have, also work in other areas. So some of those will be national providers, some of them will be regional providers. A very good number will work across the city and the county, for example, and they will share their workforce across borders, so whether it's with the city or with Warwickshire or Hamptonshire or Lincolnshire. And that does create a bit of an issue for those providers, because clearly we have to understand that they don't want to operate a two-tier workforce. So it's very difficult for them to have different conditions in Leicestershire to the conditions that they might have in other areas of the country, particularly if some of those staff are crossing borders. So there's a deal of work to do, I think, in terms of working with providers around some of these developments. The other issue, of course, is a national one. And some of the implications, for example, implications of a real living wage are issues which probably need to be addressed nationally as well as locally. And as you might be aware, there are conversations taking place, and there are ideas being put forward to government ahead of a social care reform white paper, which talks about perhaps a sort of a national living wage for care staff, which might be higher than the normal national living wage. And there are other people saying, well, can you align terms and conditions in the care sector to terms and conditions in the NHS, for example? So those are the sorts of conversations which we can add to the commentary as a local authority, but these are national conversations. And hopefully within the next 12 months, a reform paper will be brought forward, and I am led to believe that there will be certainly a chapter or a section within that reform paper which will talk about work.
Thanks, John. You promised me that paper for the last 3 years. I think I've been chair of this committee. Mike.
Thank you, Chairman. Obviously, I think all of us would hope that we could, as far as possible, achieve the ambitions of both charters as soon as possible. Obviously, there's severe practical stumbling blocks towards that. And as John has mentioned, one of the issues, of course, is the real living wage and the fact that it would cost £5 million. Ideally, we would be able to meet that cost. But obviously, as we know, Leicestershire is not a particularly well-funded authority. And obviously, we have to keep lobbying to pressurise the government to fairly fund us so that we can have the money to start doing the kind of things we want to do. But if the government does bring forward some kind of nationally delivered policy towards care workers, then certainly that would be one welcome way of doing it, because as we all know, care workers have gone out of their way to get us through the pandemic and done tremendous work for what's a very poorly remunerated job. So as far as possible, yes, it looks like we can do what we can locally, and we need to do all we can locally to pursue this, but also obviously nationally we need movement from the government on this as well in terms of funding and more generally.
Thanks, Mike. Does anyone else wish to speak? I think just to pick up on some of those points, that one thing I've been immensely proud of in my time as chairman of this committee is how much work we've put into keeping people in their homes, looking after them and doing things. And I think that even practically trying to take the best bits out of these charters that we can, whilst understanding the implications of other bits that need more work, I think is the way forward. Clearly, finance, as Mike has alluded to, is a key issue which is beyond our control in this council to a large extent. We can only do what we can do and continue to lobby government. And we would hope that the proposed white paper will be coming. But I do think there is a credit to our staff in the fact they are working with providers. Providers are listening to us about trying to improve their standards and quality of care, although we'd all like it to go further, I accept. So I think on behalf of all, as I'm sure that we say, we're very pleased with what the team are doing, and thanks to John, Nigel and Kate, and if they can pass that on to their teams, that would be great. And we look forward to interest and updates on this paper going forward, particularly some of the detailed information that John alluded to and finding out what other councils have done, and particularly just little things that haven't perhaps occurred to me as clearly as they should have been, the cross-border implications for national companies and two-tier pay systems or multi-tier pay systems potentially that could arise. So it's not a simple paper, this one, and I'm sure it's one we'll be coming back to several times, and will occupy John and the portfolio holder, I'm sure, fully for the coming 12 months. So thank you for that, and we note the paper. We're now moving on to agenda item 12, which is the visual and sensory impairment service, which is kicking off with John again.
Thank you. Just a very brief introduction to this one. Just to say, as it says in the report, and to note that the Care Act does make specific reference for services for people with sensory impairments, There are statutory requirements on the local authority to provide a site register, for example. We're legally required to maintain a register. We're legally required to ensure that information and advice services are available to people with sensory impairments, and particularly to ensure that any information that we provide, whether that's web information or physical information, are accessible to people. And there is a requirement to provide rehabilitation services within the Care Act. So it's an important area of service. We are in the position at the moment of needing to go out to the market, to test the market, to re-procure the current contracts. And the purpose of this report is to set out the conclusions of a recent review of the Council's visual and sensory impairment services and seek committee's views on the forthcoming procurement, which we'll be looking to start from the 1st of October of this year. So again, I'll ask Nigel and Kate if they will present the report and answer any questions from them.
Okay, thank you, John. So the current visual and sensory impairment service provided is commissioned through Vista, the local charity, and it's been operating since October 2015. And paragraph 8 just really details the elements of what that service is. It's a rehabilitation service. It maintains a site register. It deals with equipment assessments and requirements, and also covers the deafblind community care assessment support service. And there's more detail on each of those elements in paragraphs 9 to 16 of the report. Just in terms of the budget for this service, it's generally around £166,000, and that includes £6,000 for the purchase of the equipment element of that provision. Moving on through the paper, paragraphs 17 to 30 focus on the reviews that have been undertaken, and particularly looking at the 2021 review. So between January and March of this year, we carried out a review of that service, and that included consultation with people who use the service, Vista staff themselves, partner organisations, and the Council's adult social care operational and public health teams. And an analysis of quality and monitoring data took place in parallel. A number of people were identified either as a user or a carer of the service, and they were involved in the consultation. And the details of some of the things that the lines of inquiry were included in that work are outlined in paragraphs 21. So they were asked things around their opinions of the service, the equipment received, the support provided, and so forth. And the feedback from that engagement was overwhelmingly positive, and suggested that the service does provide emotional and practical support, which enhances the user's confidence and independence, and gives them some choice and control over their lives. And as an additional element of that quality, paragraph 25 just notes that the RNIB, the Royal National Institute of Blind People, has produced a document, 10 Principles of Good Practice in Vision Rehabilitation. And from the service review perspective, it can be concluded that the service that's currently commissioned does meet the principles listed in that document. Paragraphs 26 to 30 just focuses on the key data around numbers and the outcomes of service. So there are some 3,158 people listed on the site register. 2,900 of those are adults. And at the end of April this year, there were around 2,000 clients that accessed services from Vista. And around 300 of those were new referrals from the last quarter. The numbers of people accessing the service increased in the last financial year during the pandemic, and this is despite the number of people attending appointments at hospital ophthalmology departments. And from the start of the pandemic, Vista carried out welfare calls to over 1,000 people living alone to update them on a whole variety of things. The review findings suggest that the service is achieving its outcomes and meeting the department's model for care, which continues to focus on delivering the right support in the right place. It, you know, sort of at the moment that seems to be met. Paragraphs 36 onwards really look at the RNIB reporting that the numbers of people aged over 18 and over living with a visual impairment are expected to increase across the county by 2030. And they're expected to be around 31,000 people in Leicestershire living with sight loss, which is an increase of 25% from 2021. So future services must take into account the increased demand for services with those needs. And also on paragraph 39, the report details again a forecast increase of people with hearing loss as well being projected. So looking from paragraph 41, the future procurement of the service, based on that review and understanding the requirement for the service, the proposal is to retain many of the key elements of the service specification that's currently in place. And therefore, the specification for the service from the 1st of October this year will be very strongly based on that successful model, which has been in place since 2015. And similar to the last procurement of the current service, that'll be based on research into market appetite from the review. But there is a suggestion that there does continue to be a limited market interest in providing this specialist service. And this can present a risk either that there be no bidder at all, or in the event of very limited interest, that the council will need to seek assurances of the value for money of any bid. So the recommendation for this committee is to comment on the proposals that the forthcoming service spec be based on the model currently in place, and to make any further considerations ahead of the procurement time. Thank you.
Thanks, Nigel. Before I open to questions, one thing we did ask John in the briefing earlier today was the chart on page 32, paragraph 26, the very first row. The number of people on the site register over 18 seems to have dropped dramatically despite the level of referrals that you've just mentioned earlier. And we just wondered if there was any awareness of the reason for that, because at first sight, the figures seem somewhat strange compared to the report.
Yeah, Kate, did you want to pick up on that? Because I think we've just done a bit of a check on why that is.
Yes, I can respond to that. Vista advise that during the pandemic, they conducted a comprehensive ring around of everybody on the site register to ensure that their needs during the pandemic were catered for and whether they had any particular support that they required. And in the course of that comprehensive ring around, they determined that a number of people had sadly passed away and therefore needed to be removed from the formal site register. Therefore, it can be considered to have been a complete review of the individuals on the site register, and as a result, a large number of records were removed from the register, and therefore one could probably surmise that the number of 3,500 on the site register for 1920 is actually probably slightly overstated, but we now have that helpful baseline of just under 3,000 people on the site register to move forward from, and will ensure that there are data cleansing exercises undertaken for future years.
Thanks, Kate. So just following on from that then, so what you're saying is we probably have the most accurate register we've ever had because of the full review taken about. So at least that's one very minor plus point from COVID. But on the contra side, presumably we have some concern about people not having been referred because they haven't been through ophthalmology at the hospitals, etc., which is our normal referral route, which we've got no visibility on. Do we know how well those clinics have been operating during COVID? Have we got any information on that?
I don't have any up-to-date information on how they're presently operating. My understanding is that services are starting to revert back to something more usual. I think looking at the data that Vista have provided that's within the report, they were able to demonstrate that they provided services in a very flexible way during the pandemic, which were able to respond to people's needs, whether they were on the site register or not.
Thanks, Kate. Are there any questions? No, I think you've answered all the questions. Thanks, Nigel and Kate. And I think I'm taking the silence to be that members are broadly in agreement with the direction being taken, re-tendering and basing services on the current model. And I think it's good that we've probably got the most accurate record base we've got to springboard from. So thank you for that. We'll now move on to agenda item 13, which is procurement of community life choices services, which is pages 37 to 48 in your agenda pack. And again, we're starting with John again.
Thank you, Chair. The Council operates a commissioning framework for the provision of day services, which are known locally as community life choices, which allow service users a choice of provision from a selection of pre-approved providers. Community life choices services play an important service in helping individuals build positive social relationships, participate in the community and enjoy good physical and mental well-being. They also provide an opportunity for respite for carers, thereby decreasing the potential of carer strain. Commissioning process that we're currently working under was commenced in January 2017 with the implementation of the current framework agreement, which reduced the pool of providers from 73 down to 24. And this contract is due to end on the 30th of November 2021. It actually was due to end last financial year, but given the pandemic, we didn't feel it was appropriate to go out to the market at that point when providers were concentrating on providing services in a very difficult situation. So we extended the contracts last year, and therefore we can't extend further again this year. In addition to the framework, there are 10 services provided directly by the County Council, by the County Council's direct services. And they provide a mix of community life choices services to older people and people with learning disabilities and people with physical disabilities and frailty. Those services are provided on a one-to-one setting as well as in group settings and across 10 different buildings across the county. The report is due to be presented to the Cabinet in June, 22nd of June, setting out proposals that are contained in today's report. And the committee's views on those proposals will be incorporated into the report that goes to Cabinet on the 22nd of June. Specifically, the Cabinet will be asked to agree that the Council goes out to procurement for the CLC framework on the 1st of August, that we consult with current in-house CLC service users and their families on the potential to move those services to the independent sector. We conduct reviews of everybody who uses a county council service to establish their ongoing requirements for community life choices services, and we consult then on reducing the number of in-house services, particularly those services that provide maintenance long-term day services, by transitioning those people into appropriate independent sector services. So subject to agreement with those proposals, the outcome of that consultation would then be reported back to Cabinet in the autumn of 2021, and we'll be bringing a report back to this committee in September on the progress towards that consultation. There are a range of people standing by to answer any questions that members may have. Nigel, I think, is going to take us through the detail of the report. We've also got Kate, Christine Collingwood, Heather and Claire all available to answer any questions on detail of the report. Thanks, Chair.
Over to you, Nigel.
Thanks, John, and thanks, Chair. So the paper John's obviously covered the background. It's worth, just in terms of the content, noting paragraphs 7 to 12, which looks at the impact of the pandemic on the CLC provision. And that's really to note that the providers were very creative and flexible in delivering a range of support. And there's some examples in paragraph 8 of how they set about that. And since the start of the pandemic, the council's been actively managing all users of CLC services, both external and in-house, to make sure that those people are receiving the support that they need, and risk assessing those cases to enable a restart of appropriate support in line with government guidance. At the moment, we can say that around 80% of people now have returned to those services as we emerge out of COVID. Paragraphs 13 on in the report just details the framework. It was originally designed to focus on promoting people's independence, ensuring consistency and equity in service delivery. And you've got some details there in paragraph 14 of the pricing structures and the spend per week on services. Paragraph 15 outlines the 5 different lots in which the current framework is currently servicing, organised and separated. At present, we've got over 530 individuals access services through the framework. 80% of those are under the age of 65 and 73% have a primary support need of learning disability. Further detail of the take-up of those services is set out in the appendix of your report. Additional to that, an additional 400 individuals purchase day services via their direct payments. Paragraph 18 just states that it was originally due to end, as John said, in September, but that's been extended and it now ends on the 30th of November. So paragraphs 19 to 25 broadly detail the details of the procurement. Paragraph 19 has got the indicative timescales. Considerable work, it's worth noting, has already been undertaken in preparation for the reprocurement of CLC services, and that's included engagement with customers and providers and identifying emerging gaps in the market. For example, services for those with physical disabilities and those with mental health issues. And people who've used services have highlighted the negative impact of social isolation during the pandemic period and their keenness to resume contact with their friends and return to activities that they've been used to doing. Paragraph 23 just outlines that it is proposed for the purposes of this to undertake a light touch approach to the procurement, prioritising any changes to the current spec to reflect any key lessons learned, and also create the time to work on the in-house provision as is set out in the report. And paragraphs 24 detail what the main changes proposed to the current framework are. Those are the main features are to move to an open framework, to give the council the ability to reopen the framework wherever required to address issues such as unmet need or a provider exiting the market, to focus on key outcomes for the CLC service. That's to develop the skills and confidence of more independent living, maximising health and well-being, supporting carers' health and well-being, including facilitating access to employment, education and training, and to provide a choice in and where services are delivered, and also to provide greater flexibility, moving to a 7-day or evening service for some types of provision, and to reflect the delivery of virtual services where appropriate and agreed with the service user. It is recognised that there's potential for more significant changes to be made to the CLC service than those that are proposed in the upcoming procurement. In particular, for example, looking at the council can move to an approach which focuses more closely on outcomes for individuals. But this work will require extensive engagement with people who will use the service, their families and carers, and the market at large, just to make sure that the service is effective and there's sufficient capacity. So it's proposed that the service is comprehensively reviewed over the next 2 years. Just moving on to the in-house provision, that's covered in paragraphs 26 to 34 of the report. Here, there are around 112 people accessing in-house services across those 10 buildings, as John outlined. And over time, it's worth noting that the council's share of the CLC market has steadily reduced. So consideration is now given to how best to use the resources available to the council to deliver the right outcomes for those users. So to that end, the council's proposing to focus its in-house service provision on crisis care, short-term reablement and enablement and support for carers through a delivery of a responsive 7-day-a-week service and ceasing the provision of long-term maintenance CLC support. The pandemic and the upcoming procurement of the CLC framework has expedited the need to look at alternative delivery methods, so from do nothing to what's being proposed, and work is planned to test the external market to establish whether capacity can be developed to meet the needs of those people who currently attend those in-house services. Consultation with all current in-house CLC service users will be needed, and that's set out in the report. And it's expected that this work won't be concluded by the time the new CLC framework is live, but flexibility to periodically open the framework for new providers will accommodate the proposed changes if and when these are agreed. So it's proposed that a consultation exercise is undertaken with those who access in-house services, and that will run from August to October of this year, and seek to identify individual needs and outcomes and use that data to develop the new CLC framework. An indicative timeline for that work is set out in paragraphs 33, and paragraphs 35 to 8 look at the resource implications for the work. And as John has said, I think a report will come to Cabinet on the 22nd of June, setting out the proposals outlined, and this committee's comments will be incorporated in that report. So happy to take any questions, and as John has said, there's a range of colleagues here that can help with that. Thank you.
Thanks, Nigel. Do I have any questions? I think the sheer number of you has stunned them into silence, so it's left to the chairman. So if we can go to page 40, I think it's 24B. I just wonder from what you said, Nigel, where you're looking at a comprehensive redesign of the service, and clearly we want partners to work with us in that, the partners that are chosen through the framework agreement. It just strikes me that 2 years, are we comfortable with 2 years for an initial? If I was someone tendering for this and you wanted to redesign a service with me and then work with me, I think I'd be looking at more than 2 years to put that effort into it, particularly if I might keep it. I know there's an option to extend, but I'm just thinking, are we going to get the best people tendering for this with such a short time period? And is that something you're comfortable with? I don't know if this might be John or Nigel to pick up.
Yeah, I'm happy to give it a go. So I think the paragraph that you quote there, the intention, we perhaps haven't made it as clear as we should have done. So the intention is that the current framework that we will go out to procure now will be a 2-year framework, in order that over the course of that 2 years, we can redesign for the future. So what we're intending to do is put a short framework in place now, rather than going out for a 5-year framework now. We'll put a short framework in place now. We'll cover the next 2 years with an option to extend if we want to. But we'll use that 2 years to engage with providers and with people who use services to see how we might develop a different form of framework in the future. What we want to move to is much more of an outcome-based framework. At the moment, we've got a framework which is kind of service-based. So, for example, we require a certain set of services and we pay a certain rate for those services. And then when we assess people, we're assessing them against those services. What we want to do is provide a framework which enables people to have individual outcomes met in a very different way. So we're not just paying for a morning session or an evening session. We're paying for the delivery of an outcome. We think that could take us a couple of years to get there, which is why we want to put this framework in place now and then have those conversations over the next 2 years.
So I think what you're saying, John, is you're confident we will have the right people bid for this that we can work with, who might understand and work with us on that basis. Because I don't think anyone can argue with the outcomes that you're looking for in paragraph 24C. I think that's what we'd all wish for the residents of this county that need those services. So I think it's something obviously clearly this committee are going to need to be kept up to date with. But this is quite an interesting thing going forward, because if we can move to the outcomes model, I think it's better for everybody. And I think it's something we'd all applaud. Are there any questions from anyone on this? Right, so we're happy with the approach then, John, that's being taken, and we'll look to be kept up to date going forward. And sorry that we didn't bring in the multitude of officers that were waiting in the wings, but thank you for your attendance. We're now moving on to the last agenda item, which is agenda item 14, which is the Provisional Performance Report 2021, set out in pages 49 to 64 of the agenda pack. And John's going to introduce it as he has with all the reports.
Okay, thanks, Chair. This is going to be the briefest of briefest introductions, because I'm going to hand it over more or less straight away to Matt, who's going to present the full report to committee. So I'll just go straight over to Matt.
Thank you, John. Thank you, Chair. Good afternoon, everybody. Yes, this report is a summary of the most recent year, 2020-21's performance. I'll just go through a few points just to note to start with. The figures are provisional at this stage, as we've only just recently provided them through to NHS Digital, who are the national body that collects the data from all local authorities. However, we don't expect there to be any notable changes to the figures that are currently in the report. NHS Digital will actually publish the final figures in the autumn of this year, and these will be presented to Scrutiny Committee in the format of benchmarking against national averages and similar local authorities at a meeting probably in January. And finally, the ongoing COVID-19 pandemic clearly impacted a number of the metrics throughout the year, and this has been reflected in the report. I suppose the most obvious of COVID-affected metrics are those relating to heritage sites and library services. Visiting these sites and libraries was not possible during long periods of the past 12 months, and the impact can be seen in the figures shown in Appendix A, particularly when you compare them to the previous year. As such, one area that did flourish was that of library e-loans. These total 783,000 during 2021, an 89% increase on the previous year. The success rate of Leicestershire's adult learning service is currently at 86%. This is within the 2021 academic year, which doesn't actually end until July, and the performance is currently in line with the target, despite needing to run the majority of classes online during the past 12 months. Turning our attention then to adult social care, there are 13 metrics reported against a target for the year. I will highlight a few areas where performance met the target and those where the pandemic has had a greater level of impact. In relation to settled accommodation and employment for people with a learning disability, performance was good in 2020-21. The proportion in settled accommodation showed continued improvement, and whilst there was a small reduction in those in the proportion in employment, it is expected to remain high in comparison to the national picture. Moving on to reablement, this is a service that has notably been impacted during the past 12 months by the pandemic, and highlights the higher and more complex level of needs of people discharged from hospital. During previous years, the proportion of people not needing an ongoing service following their reablement improved year on year, and at 88% in 2019-20, performance was actually in the top 25% of authorities in England. At the end of 2021, however, performance has dropped back from that 88% to 81%. Similarly, the National Performance Framework includes a metric that monitors the success of reablement services by measuring the proportion of people still living at home 3 months later. As with the previous metric, an improving position during the past few years, and one that was above national average, has dropped back in 2020-21 from 88% to 85%. Looking at permanent admissions to residential or nursing homes, performance in relation to people aged 18 to 64 has been very good during the past few years and has continued into 2020-21 with just 17 admissions. This is down from 25 in the previous year. For people aged 65 or over, the number of admissions has previously been lower than the national average. 2020-21 saw a further reduction, and the original target set for the year was met. We need to bear in mind, however, that this is partly due to a reduction in admissions during the spring and early summer of last year as a result of that initial first wave of the pandemic. Finally, the National Performance Framework includes 4 metrics relating to personalisation and the provision of direct payments. During 2020-21, performance was very high, mid to high 90%, although these fell short of what were particularly challenging targets. And at 43%, the proportion of people in Leicestershire with a direct payment remains particularly high and potentially in the top 25% of local authorities. So to summarise, 2021 was clearly not a typical year of performance and activity monitoring, although saying that we're already moving on and are now setting up reporting processes for 21-22 and setting targets for the forthcoming year. Thank you, Chair. Welcome any questions or comments from the Scrutiny Committee.
Thanks, Matt. Betty.
Sorry, it's paragraph 17, and you talked about carers and the impact on carers. I have a particular interest in young carers, and I wonder whether the survey is just going to take on board the views of adult carers, and if so, perhaps the authority would consider doing a survey into young carers as well. Thank you.
Yeah, the guidance for the survey, which has been postponed from last year, as the paragraph explained, to the autumn of this year, will have set national guidance with it that we will need to follow strictly. I will need to double check on that, but I think it's open to all levels of carers who are on our system and are caring for adult service users. So it will predominantly be older adults over 18, but we can look into that. And also, when we do get the data back, it's worth looking at the data by an age breakdown of those carers.
Thank you very much.
Anyone else? Christine.
I don't know whether I'm allowed to comment, but I'm going to anyway. When I was on
Chairman's prerogative, of course you can.
When I was on another committee for children, I know the children's carers were being looked at. So children who were doing caring for adults, that was being looked at. So whether that will come under the umbrella of the children's services, but I do know that I brought up the fact that we need to keep an eye on the children that are doing caring. So, you know, to put Councillor Newton's mind at rest, we are looking at it, as I know, in the children's department.
Thank you. It's just it's my research area from university, and I would hate to think that young carers would drop through the net. Thank you.
Thanks for that, Betty. I don't see any more questions. I would just highlight one thing that came out of the briefing this morning that John mentioned, which I know the portfolio holder is aware of as well, is that, you know, through this awful pandemic, I think John gave the statistic that care packages at home have been extended by 2 hours for an adult, which doesn't sound a lot until you actually monitorise it. Now, yeah, it is the right thing clearly to look after these people, but with the aspects, as John mentioned, of long COVID and people not receiving treatment in hospital for other illnesses that they might have done, it could be a knock-on impact to this council in terms of how long we might need to look after people, the size of their care packages. I just want to reassure this committee that our director is aware of this, as is our portfolio holder, and it's something they're looking at very closely, and we'll bring back to this committee if there are any implications, because clearly that will have to be looked at going into the budget planning, which is coming up all too quickly later this year. But it's just to give that reassurance to committee members that it is on the agenda, it is on the table, and that we will do everything we can in the best interests, as we always have as our residents. So thank you for that, Matt. I don't think you've got away lightly. I keep saying that every time you come on. I think you frighten people with your statistics. Thank you very much.
Thank you.
We're now on agenda item 15, which is the date of the next meeting, which is scheduled to take place on the 6th of September 2021 at 2 p.m. At least it's the day after my wife's birthday, so I won't get in trouble. There are no urgent items, so could I thank you all for attending today's meeting? Could I thank all the officers for their reports and presence? And can I extra specially thank any members of the public who've dialed in? So I think the figures of people, members of the public dialed in, actually I believe have gone up over COVID, which is at least another positive aspect if it gets people to look at what councils do and the business they conduct. So thank you all.
Thank you.